Hi, welcome back to Raising Families. It's going to be another exciting show. We're going to have a guest. Her name is Kathleen DeCarlo, and she is the wife of somebody who I hold dear, who is Steve DeCarlo. He is one of the producers of Raising Family, and his wife is here to talk to us. She is a behavioral analyst, a board-certified behavior analyst in the Malden Public Schools. And in Somerville, we have a very good, in-depth special education program. But Kathleen works in Malden District, as I said, and she can give us information in general about the special education laws, and also she can help us understand the universal state regulations around these things. And so I think it's going to be very informative. And personally, I have had a lot of experience with this, but from many years ago, because I have two children who have had special needs, and it's going to be really exciting to me to both see where we were at one time and where we now are. So we're going to welcome Kathleen. Welcome. It's been a while coming, but I'm very excited that we're getting to do this. So welcome.
Thank you.
Yeah. So let's see. I had a few questions to start with. So how does one become a behavioral analyst, and what does that entitle? And you told me a little bit before the show about your personal interest, and I'd love to have you talk a little bit about that too, if you feel like it, like how you got involved in this.
Sure. Well, I've been in education since the late 80s and moved into special education. And I worked at the high school level, students from 9th grade all the way to transition age 21. And I saw a lot of youth, young adults with severe behavioral challenges, and they came without communication systems that were functional or behavioral strategies to help them find success in life. So I was familiar with the field of applied behavior analysis, which basically it's a scientific methodology to understand behavior and to with regard to environment, to help change those behaviors. So I went back to school. You have to have a master's degree before you go into the program, and you have to get approved. And mine was Behavioral Interventions in Autism. That was the name of my program. And I had to do a series of courses and do field work to become licensed, and then I took a 4-hour board exam following that. That was brutal.
I can imagine.
So that's how I became licensed. There's a lot to do to continue that license, but my heart and my passion is to help children, people of all ages, to get the skills that they need to be able to function in life and find success.
Yeah, it's so important. We were talking a little bit before the show, but with my children, I can see, that even well into their adult years, they struggle. So, so how have things changed in that regard? Like how, that's what you do, and how have the laws changed, or how does that show itself, in actual ways of helping somebody through learning disabilities and struggles like that?
That's actually a very good question and a very important topic. So we have the Individuals with Disabilities Education Act that it's been around since 1975, but in 2004 we had the revisions. There are several parts to it. It's a federal law, and basically it ensures that children who have disabilities have the right to receive services. And I think what's changed is that parents are more aware of their rights and the rights of their children. So there's a process now that, and school districts also are more aware and are more involved and communicate to families what their children's rights are. So this whole process under IDEA, it can be overwhelming for parents, but you know very well, and especially having come through the ages, with your children with disabilities, seeing what was available then and what's available now.
Yes.
You've seen firsthand some of those changes and the difficulties that accompany that with understanding the language when you're in a meeting and the terminology. It can be a lot. So I think that school districts have done a better job at helping parents understand the terminology. We have that the notice of procedural safeguards that we give to all the parents, and helping them understand that through the process. So children, if they suspect their child has a disability, they can go to the school team and request assessments to be done. Sometimes children will come to school with a diagnosis from a physician. So if any time a parent suspects their child has a disability, of course they can go to their physician. But the school district will put together a team, they'll do assessments and decide whether or not the child qualifies for special education services. And that usually is dependent upon whether the disability affects progress. I'm not sure what your experience was with that.
Yeah, well, it was so long ago too. I don't really know, but given the dates that you just said, I bet that my children were just kind of on the early end. Are you describing the 766? I think is what it was called.
Yes,
yeah, that's what it was called back then. Okay, and so what were the revisions? What happened during the revisions in 2004?
Well, 2004, there are several parts to the law.
Oh, okay.
But basically, again, it ensures that children with a disability have the right to, it's called FAPE, Free Appropriate Public Education.
Oh, yeah.
FAPE is the acronym.
Very good.
So, again, I think parents are more aware of what their rights are, and they're their child's best advocate. Sometimes families will hire an advocate to accompany them to meetings. If a child, after the child has assessments done, the team comes together and they do what's called an initial evaluation. And at that meeting, the school team decides whether or not the child qualifies for disability, and if so, what the individualized education program will look like. Every child has the right to a free and appropriate public education, including children with disabilities. So the IEP will set forth what areas of that child's kind of school academic life will need to have specific goals and objectives to help them find success, make progress in school.
Yeah, I don't remember anything like that. I think you asked me what my experience was. I don't remember anything like that. I will tell you one kind of, it's comical in an ironic sort of a way. It's not really comical, but one of the solutions when one of my children was having difficulty with behavior in school was to have me come in and sit beside him, in the desk beside him, for several hours a day. So I would come in, he would go in, and if he was not having the ability that day to structure his behavior, they would call me. I would come to the school and sit with him. It worked for a while, but I bet there's not a whole lot of that going on nowadays.
We don't. That's not one of the strategies that we use to improve behavior.
I think that's good.
So one of the ways that I get involved as a BCBA, so if a child presents with behaviors that interfere with social communication, functioning during the school day, or behaviors that are harmful to themselves or others, I will get a request for a functional behavior assessment. I'll come in and I assess the student's behavior. I will speak with the teacher, paraprofessionals, parents, collect a lot of data. Applied behavior analysis is very data-driven. We analyze behavior based upon how a strategy improves a child's behavior, and that's all data-driven. So I'll come in and I'll do an assessment, and then when we meet as a team, I'll talk about the function of the child's behavior, why the child may do what they're doing. Behavior is not bad. It's anything that we say or do, and a lot of times I get called because of the bad behaviors.
Right, yeah.
So we'll talk about why the child's doing what they're doing. So let's say maybe they lack some functional communication skills where they're hitting to get something rather than asking appropriately. So if the function of that or the purpose of that behavior is to get something, then what I'll do is I'll replace the bad behavior with something more socially appropriate. learning to ask for help, learning to ask for the item, using sign language. We have a picture exchange communication system where they pass pictures. Some kids who are verbal, they can obviously learn how to verbally communicate, I want that, or I need help. So it's we want to decrease the problem behavior and increase a replacement or more socially appropriate skill or communication system.
Yes, I remember once a long time ago getting some inkling of this because there was a child in preschool, where my granddaughter was in preschool, who was biting. And somebody at the school talked about that she was trying to communicate something, and instead they gave her a washcloth when she would be biting, and let her, now that's only one way to handle it. I suppose it would have been better if she could be taught verbally how to ask for what she's wanting, but at least it was she wasn't shamed or looked down upon because she was doing that. It was clearly an act she was doing to get something she needed, right? So yeah.
I think it's important, we're all people, and some people were born with disabilities, and we have to respect the dignity of every child, every person that we work with, and finding something, for example, this little child who was biting, finding something that's more appropriate to replace that. Sometimes the biting is just like a sensory. It feels good, even though it may cause harm to a child. Sometimes they do it because the behavior in itself they like, so we have to teach them to chew on something else, like you had given that example. We have chewies. I work together with occupational therapists, speech language pathologists, physical therapists. It's a very collaborative approach to find alternative means to replace the behavior. A lot of it is sensory. You kind of mentioned that a little bit, and we find alternative ways for children to get their needs met. And also, again, all behavior is communication. Anything we say or do, think about it. Our eye gaze, our posture, we communicate a lot without saying a word.
Yeah, good point.
All of our behavior is communication. So it's replacing, again, that the behavior that's used in a not so good way, and replacing that with functional and appropriate communication. We want our kids to have success.
Absolutely. And sometimes it doesn't involve big major things. It involves things like this, just helping them find a better way to communicate. That's wonderful. So what falls under special education? I think you've answered a little bit of that, but say more if you can about.
Sure. Well, under IDEA, there are, I think, 13 categories. In the state of Massachusetts, if you go to it's called the Department of Elementary and Secondary Education.
Oh, yes, I heard that.
It used to be called the DOE, Department of Education. The website still is DOE.
Oh, okay.
But that's something that, maybe can be shared afterwards. If you go to the DESE or DOE website and you look up special education, it will list all of the different categories that a child can qualify for special education under. For example, autism, which is a developmental disability that has a child presents with impairments in language, social skills. A lot of times children with autism have repetitive or stereotypical behaviors. They may have sensory-related issues. We also have, there's communication disorder, developmental delay, hearing impaired, visually impaired. There are a lot of, it's about 10 categories under the mass law.
So that's one different thing. I mean, I just remember when my children were young that it was learning disabilities or ADHD.
It was kind of all lumped into one.
All lumped together, right? This is wonderful.
Well, now there's also we have what's called the 504, Section 504. So if a child doesn't qualify for an IEP, they still may qualify for accommodations during the day. You mentioned ADHD.
Yes.
Some children who have ADHD may not qualify for a full IEP where they need intense services. They just may need accommodations in the classroom, maybe extra breaks or organizational supports in the classroom. So that is also available for children.
That's great. This is so important for parents to understand, I think, because when we talked a little bit earlier, too, you mentioned that parents are both more educated about this now, so they know more of what their rights are. But if they don't get these little nuances, maybe, which you're helping us to understand, they may think that they should qualify for one thing when actually they only need this, and vice versa. That is very interesting. Yeah.
You know, I applaud you for raising children with disabilities. I think it's a lifelong job,
yes,
lifelong commitment. I have compassion for parents who've just found out that their child's been diagnosed. My specialty is with autism, and I know that a lot of children present maybe ages 12 to 18 months with autism, and it's a shock to a lot of parents when they say, what is this and how do I fix it?
Yeah.
And I think that helping parents understand that, there's nothing wrong with your child. Your child has autism, your child has a disability, and these are the interventions that we can use to help. Research has shown that early intervention is very effective for helping children with autism make progress, develop functional communication skills, develop social skills that we would typically pick up on.
Yes.
We would pick up on, like when someone walks into a room to greet them. A lot of children need to be explicitly taught these skills because of their impairments, especially children with autism.
Very interesting, but they can be helped to learn those things that are not coming naturally.
The autism spectrum is very wide. We have children who are, present with some very severe deficits. Some children are not able to speak, whereas some people with autism may be able to go to college and get degrees and function fully in life, but just need help with some of those social deficits. So, the range is very, very wide. Back in 2000, I believe it was 1 in 110 children were diagnosed in the U.S. with ASD, autism spectrum disorder. Now, I just looked, and I believe it's 1 in 68. So it is becoming more prevalent, and some have even said that ratio is even lower.
Really?
So it is becoming more prevalent. But the good thing is that we know better how to treat autism. Again, early intervention, applied behavior analysis is a science that is very positive and very effective to helping children with autism. Insurance companies are paying for services in the home, and a lot of parents are becoming more aware of that, so they can advocate for services for their children.
Great. That's great. So speaking of parents again, so how would a parent go about finding help for their child? Is this something that gets offered to them automatically in school, or do they request it? I know you said one way is to talk to their pediatrician, but if they were going to go through the school route, what would they do? So
you would talk to the school team, and you would request assessments. A lot of times the school themselves will say, hey, Mom, Dad, we're recognizing your child's having difficulty with this. We'd like to do some tests. May we have your consent? So once consent is signed, then the assessments take place, and then you have the initial evaluation meeting, and then that's where the team decides if there is a disability and what services. This is to answer your question. That's where the services are determined.
Okay.
The team will say, I think this child might need 30 minutes of speech language intervention a week. They might need 15 minutes of occupational therapy services to address a variety of needs. It could be some motor skills with learning how to zip, tie, eating skills, a variety of skills. And then if I'm at the meeting and I say, oh, yes, your child needs some services for helping reduce problem behaviors, and I would say, I'll go on the grid for X number of minutes per week or per month to help address the child's needs. So that's in the school setting. If a child, so parents also can go through their insurance company to get services for applied behavior analysis, and that's something that they can do through their physician as well.
Oh, interesting. This is fascinating.
Yes.
Okay. And you mentioned just now hit again on something we mentioned earlier, maybe not on air, I'm not sure, but about, so some of these disabilities can be, go on for a very long time. So what kinds of things are helping these young people to become better able to function as adults? All of the things, well, let me back up for a minute, I guess I'm getting ahead of myself. But when you were talking about, so them learning how to tie or zipper or things like that, those are clearly not just specifically academic things. I mean, those are things that they need to be functioning as adults. That's not like, or functioning at all. It's not like just like math and science and English or writing or something. So those are being addressed in these IEPs, or if the child needs those services, that will be addressed.
It's actually a very good question, and something that is becoming more prevalent in our school districts. People are becoming more aware of our need to prepare children for life outside of high school. If a child qualifies for an IEP, starting at age 14, they can participate or should participate in the IEP meeting. They're the focal person.
Really?
Yes.
Wow.
So we encourage that, and it's called person-centered planning. So we need to work on developing life skills. So yes, academics are very important, absolutely, but those life skills that, again, we may be able to pick up on and do, these children need to be explicitly taught.
Yes.
It could be even toothbrushing skills, learning how to write a check, or now use a debit card.
Yes.
Stay with technology. I don't know, I know we had mentioned beforehand that children qualify for services under IDEA up until transition age, which is 21. So when they turn 21, then that's when they have to leave the school system.
Right.
After they're 18, the age of majority, they can stay for another 4 years if they qualify for a certain percentage of need. So if they are able to stay for those extra 4 years, we've got more time to develop those life skills that are necessary for post-secondary life. Some of the areas that we work on, I should backtrack. In addition to the IEP, we write what's called a transition planning form, and that form addresses those skills, education, what's going to happen with your living arrangements, when you leave, what kind of skills can we help prepare, whether it's learning to make your bed, learning to how to cook, learning how to clean, so when you do have your apartment, if that's what you go to, you'll learn those skills. So it's education, life, living arrangements, leisure skills. Our kids need to know how to have fun, how to be able to enjoy themselves in an appropriate way. And then also work, vocational skills training. So those skills all need to be addressed prior to the child transitioning out from school. And once they leave, once they reach age 20, age 21 or age 22, they no longer fall under IDEA, then they fall under the American with Disabilities Act.
Okay.
So it's very, very different. And under that, you have to advocate more for yourself.
Right. Yeah. So your job is incredibly important because you're preparing them to get to that place so that they're in the best possible shape when they're finished with the services that can be provided under age 21 or 22. Yeah. Wow, this is so interesting. See, we were talking a little bit earlier about maybe we wouldn't have enough to talk about in a half an hour. I feel like we could spend an hour and a half on this, and I'd still have a bunch of questions to ask you. But that being said, we have only about 5 more minutes left to the show. So what would be the most important thing you would want parents to take home from this show that you want to say to them? Or
I think, accepting, if your child is diagnosed with a disability, just accepting them the way that they are. They are a person, I'm a person with blue eyes. It's a person with a disability, and loving your child exactly the way that they are and being their biggest advocate. Learning what the law says, and advocating for your child's needs. What's good is we have so many amazing school districts who are so supportive of working with children with disabilities and supporting parents.
Yeah.
We don't see ourselves in isolation. It's a continuation, and it's a team. And I hope that parents, being a parent myself too, see yourself as it's a team. It's not us against them. It's a collaboration, and parents know their children the best and can offer school districts invaluable information to help them find what is motivating, to encourage learning and skill development. In applied behavior analysis, we look at rewarding the right behavior. And parents can help us with that, to find what's motivating for a child. So be their biggest advocate.
That's wonderful. I love that. I loved what we talked about earlier. We just have a couple of more minutes, but I wanted to throw this in, which is that that now it looks like it has progressed to the point where you and others who are in the same field as you are helping parents to understand the language that they may not understand, because I think there's a real tendency to, when you're a specialist in a field, to use language specific to that field, but it may not be the language that a parent understands or somebody, just a lay person understands. And in talking to you earlier, I could tell that you feel strongly that that you and people doing this should be thinking of helping parents to understand that. So I know in Somerville we have a really progressive team of people working on these issues. So that's very comforting and hopeful to me. And it sounds like Malden must have that too.
Yes, across our nation, we have so many amazing special education programs, and I think that parents need to see that there's so much support available to their children and to them.
Yeah, because they need support too. I know I sure did. It was, it's to face that anybody has a disability is kind of, initially I think you go through the stages of grief or something, it's hard to come to terms with that. And so parents need support too. And it's good to know that they're
and there's so much available for children and families, as a whole.
That's wonderful.
Yeah.
Okay. Well, thank you so much for coming on. It's been wonderful to talk to you and very helpful to understand all of this. So maybe we'll have you on again because there's a lot more questions.
I feel the same. Thank you so much. Yes. Something I'm passionate about.
Yes, I can tell, and
Yes.
that's wonderful. We need people passionate in the field doing this work. So thank you.